How to gain weight during chemotherapy. If you've been diagnosed with cancer, chemotherapy agents medications will most likely be used to cure the disease, shrink a tumor, prevent the cancer from spreading, or relieve the symptoms of the disease. This is done through injections, IVs, pills, or indirect injections to fluid around your spinal cord and brain. Regardless of how the chemotherapy is administered, it works by killing fast-growing cells. Unfortunately, this type of treatment can cause you to lose your appetite and/or experience nausea, which can result in weight loss. In this article, you can learn how to prevent weight loss, put on weight during treatment, and understand the importance of a healthy weight. Preventing weight loss. Track your weight. Since preventing weight loss is easier than trying to gain weight during treatment, keep an eye on your weight. Get on the scale at least 3 times a week. It's easy to lose track of how much you are losing when you are experiencing the side effects of chemotherapy. Your healthcare team will look for trends in your weight. For those who start treatment at a healthy weight with a healthy body mass index (BMI), a 1–2% loss over a week or 5% loss over a month are causes for concern. Put another way, this equates to a 150-pound person losing about 3 pounds in a week or 7.5 pounds in a month. Your healthcare team may become concerned with a smaller amount of weight loss if you were underweight initially when you began treatment. Similarly, they may be less concerned with a more significant amount of weight loss if you were overweight initially. Don't stress if you do lose weight immediately after a chemotherapy treatment. This is normal. Your healthcare team wants to track your weight to determine whether or not you can regain that loss by the time you arrive for your next treatment. Take anti-nausea medication. Your doctor may prescribe a medication to treat nausea and vomiting at the time of or days following your treatment. Anti-nausea drugs are available as an IV medication, pill, liquid, patch or suppository. These drugs usually fall into the category of corticosteroids, serotonin antagonists, dopamine antagonists, NK1 inhibitors, cannabinoids, motion sickness treatments, anti-anxiety drugs and stomach acid blockers. Practice good hygiene. Because the chemotherapy affects your bone marrow and immune system, you are more at risk for infections. Fever and infections will reduce your appetite, making it harder to maintain a healthy weight. Always wash your hands carefully after using the bathroom, being in public, or around family and friends. If a friend or family member is sick and infectious, use caution or avoid being around the person until the disease can't be transferred to you. Get exercise. Before you start exercising, get approval from your cancer doctor and talk to them about safety measures that you should take. It's safest to exercise in a medical setting with a partner, instead of exercising alone in public facilities that have an increased risk of infections. Know that you should stop if you feel disoriented, notice sudden onset of nausea and vomiting, shortness of breath, irregular heartbeat, chest pain, leg or calf pain, bone pain, or unusual fatigue. Improve physical ability. Improve balance and reduce the risk of falls and broken bones. Reduce muscle wasting from inactivity. Lower the risk of heart disease and osteoporosis. Improve self-esteem. Lessen nausea and lower the risk of anxiety and depression. Improve your quality of life. Improve your appetite. Reduce your alcohol intake. Talk with your doctor about limiting how much alcohol you drink before and after chemotherapy treatments, since most chemotherapy agents are metabolized through the liver, just as alcohol is. If your liver is metabolizing alcohol, this can change the way in which the chemotherapy medication is used in the body and can cause drug interactions. If you're dealing with mouth sores, you may notice that even a little alcohol in mouthwash can irritate mouth sores and make them worse. This will make eating more painful and increase the potential for greater weight loss. Opt for non-alcoholic mouthwash or children's mouthwash and consider switching to an organic toothpaste to avoid these issues. 9.